is Luis Nieves. I'm going to be performing today a comprehensive physical exam that includes a mental status, head and neck, eyes, ENT, respiratory, cardiovascular, breast, abdomen, genitalia, musculoskeletal, and neurological assessment. I have all my equipment. I have my gloves, my acuity chart, a stethoscope, reflex hammer, tuning fork, some items to check the neurological status. I have my ophthalmoscope and otoscope as well. So I'm ready to begin with my exam. Good morning.
Good morning.
How are you doing today?
I'm doing good, and you?
My name is Luis. I'm going to be performing your physical exam today. Can you tell me your name?
My name is Yasmin.
Yasmin? Okay. What's your date of birth?
October 10, 93.
Okay. At this moment, I'm just taking a look of my patient here, the appearance, the way that she answered my questions, they're correct. And checking out also her responses, how she reacts. So I'm going to be performing your physical assessment today, right?
Yes.
Okay. Do you have any issues that I might have to consider at this time? Okay. So I'm going to start with your head and neck. I'm going to be inspecting your head, making sure that there's no issues, okay?
Okay.
All right, I'm checking the hair to see if there are any bald spots, checking the back, checking for lesions around the neck, around the head. I'm going to be checking the face, making sure the eyebrows are equal. Does it hurt when it?
No.
Does it hurt?
Mm-hmm.
Can you open and close your mouth for me? Okay. I'm checking for any clicks. Do you have any issues? No problems? Does it hurt anywhere?
Nope.
Okay. I'm inspecting her face, making sure that the eyes are equal. Make sure that the ears are in the same location. So at this moment, I'm going to start checking your neck, okay? I'm going to check for any nodules, any issues. Do you have any pain when I palpate? No?
No pain.
No pain? Do you have any pain?
No.
Also, I'm inspecting the skin to make sure there's remains intact. She feels warm. Can you move forward for me? This moment, I'm going to start checking the thyroid for any enlargement. I don't feel anything. Can you go ahead and swallow for me? Go ahead and swallow again. I didn't feel anything, any nodules, so everything it seems okay. I'm gonna move on to your eyes. We're gonna do a visual acuity check.
Okay.
Do you see that the chart is a snoring chart?
Yes.
For adults, it's gonna be 20 feet away. For kids, it's gonna be 10 feet away. Can you read the last line for me, please?
CKZDB.
Okay. Then I'm gonna start moving on. I'm gonna check your eyes, and at the same time, we're gonna do some different tests because we're gonna check cranial nerves 2, 3, 4, and 6. You're gonna see a little light, okay? All right. I'm checking for constriction of the eyes. Both eyes constrict at the same time. No issues. Do you wear glasses? Any issues with your eyes?
No, I don't have.
Okay. At this moment, you're gonna follow my finger, okay? I'm checking for the movements of the eyes. All right. Okay. Keep looking at them. All right. Did you feel any pain? We're doing any of those movements? Okay, I'm gonna check for nystagmus at this moment, okay? Let me know. Okay, I didn't see any nystagmus. Alright. Okay, at this moment, I want you to keep looking and just tell me when you stop seeing the finger, okay?
There.
Okay, I'm gonna do the other side now. I'm checking for glaucoma. This is one of the most common tests for glaucoma.
There.
Okay. So I completed the eye exam. At this moment, I'm gonna start checking your neck. Okay, I'm gonna check for any nodules, any issues. Do you have any pain when I palpate? No.
Okay.
No pain. Do you have any pain?
No.
Also, I'm inspecting the skin to make sure there's no remains intact. She feels warm. Can you move forward for me? This moment, I'm gonna start checking the thyroid for any enlargement. I don't feel anything. Can you go ahead and swallow for me? Go ahead and swallow again. I didn't feel anything, any nodules, so everything it seems okay. I'm gonna move on to your eyes. We're gonna do a visual acuity check.
Okay.
Do you see that the chart is the smelling chart?
Yes.
For adults, it's gonna be 20 feet away. For kids, it's gonna be 10 feet away. Can you read the last line for me, please?
CKZDB.
Okay. Then I'm gonna start moving on. I'm gonna check your eyes, and at the same time, we're gonna do some different tests because we're gonna check cranial nerves 2, 3, 4, and 6. You're gonna see a little light, okay? All right. I'm checking for constriction of the eyes. Both eyes constrict at the same time. No issues. Do you wear glasses? Any issues with your eyes?
No, I don't have
Okay. At this moment, you're gonna follow my finger, okay? I'm checking for the movements of the eyes. All right. Okay. Keep looking at them. All right. Did you feel any pain? We're doing any of those movements? Okay, I'm gonna check for nystagmus at this moment, okay? Okay, let me know. Okay, I didn't see any nystagmus. Alright. Okay, at this moment, I want you to keep looking and just tell me when you stop seeing the finger, okay?
There.
Okay, I'm gonna do the other side now. I'm checking for glaucoma. This is one of the most common tests for glaucoma.
There.
Okay, so I completed the eye exam at this moment. So I'm gonna move on, okay? I'm gonna start checking your ears. I'm gonna use the otoscope, okay?
Okay.
Let me know if you feel any discomfort. So for adults, I pull up and back to be able to open, okay? For kids, we move downward and back to open their auricle. Okay? No, I don't see any difficulties. Have you had any hearing problems lately?
No hearing problems.
No hearing problems. Okay. I'm going to perform a couple of tests.
Okay.
The first one is going to be the whisper test.
Okay.
I'm going to stand behind you. I'm going to tell you 3 letters or a combination of letters and numbers, and to see if you're able to repeat it, okay?
Okay.
Can you repeat the letters for me?
A.
Correct. Okay. The next test is going to be called the Weber test. I'm gonna start the turning fork, and just let me know when you stop hearing the sound, okay?
There.
I have the same, it stayed the same, so I'm gonna check. This is another test. It's called the Rennes test. Okay, let me know when you stop hearing it.
There.
Okay, I'm gonna go to the other side.
Okay.
Have you noticed that do you have any difficulty hearing a conversation?
Not at all.
No? Okay.
There.
All right. So there's no deficiencies, there's no issues in your hearing? Okay?
Okay.
Any questions so far?
No questions. Thank you.
At this moment, I could check cranial nerve number 1 for a smells test. I'm not going to do it at this moment, but do you have any issues smelling? No? No issues at all? You're going to inspect your nose, okay? You're going to feel. Okay. I don't see any obstruction. No? I'm going to check the other side. All right. Everything is normal. The nose is symmetrical. Do you have any issues? Any pain? No? I'm gonna check your throat at this time, okay? Alright. At the same time, I'm gonna be checking for the cranial nerves. I'm gonna check for cranial nerves 9, 10, and go ahead. Alrighty. The mouth looks good. There's no issues with your teeth. Do you have any toothache?
No.
No? Okay. Can you sting your tongue out for me, please? Go ahead. Okay, the uvula looks normal. No swelling. It looks pink and moist. No issues. Move your tongue side to side for me. Okay. Alright. At this moment, I'm going to start inspecting, palpating, percussing, and auscultating your respiratory system, okay? Can you move forward for me, please? So at this time, I'm just inspecting, making sure that the lungs are expanding at the same time. I'm going to palpate. Do you have any issues? No? No problems? Go ahead and take a deep breath. I'm looking for the movement of the thorax. It looks okay. Can you move forward, please? I'm going to perform the same thing in the back. I'm going to inspect. Inspect. It looks okay. Take a deep breath. Go ahead and begin. At this moment, I'm inspecting the skin at the same time. I'm checking the back, making for any curvatures, any issues. When she take a deep breath, both lungs expand symmetrically. So I'm checking if there's any tension in the thorax or any issues with the lungs, because any liquids in the lungs. So I'm gonna percuss. Doesn't seem like there's any fluid accumulation. Now I'm gonna auscultate. Take a deep breath. Deep breath. Deep breath. Deep breath. Right. Now I'm gonna do the same thing in the front. You can lean back. No any issues. No crackles. No wheezing. I'm going to do the same thing in the front, okay? Checking for any fluid. Alright. I'm going to take a deep breath. Alright, I'm checking for the expansion of the lungs. It seems symmetrical. I'm going to listen to your lungs, okay? Take a deep breath. No crackles, no wheezing, everything seems okay. At this moment, I'm going to move on and check your cardiovascular system, okay? I'm going to start with your neck, checking feeling for a pulse. One side at a time, I don't want to cause any wobble. So, any distension, there's no distension. I'm going to palpate the other side. I'm going to listen, check for any roots. I don't feel or see any roots or thrills. I'm gonna listen to your heart, okay? I'm checking the heart for any murmurs, snaps, or clicks. Everything seems fine, okay? I'm gonna be checking your hands, okay? For capillary refill. Alright, at the same time I'm checking the skin, making sure that the nails look okay. There's no clogging, no issues. The capillary refill is good. You're going to be doing the same thing with the legs. Can I take your sock off? You're going to be doing the same thing. You're going to be checking for capillary refill. They feel warm, feel okay, capillary refill is good, the skin is intact, I don't see any problems. You're checking for the pulses. Okay, they're strong, +2. Checking for pulses, they're okay. Checking for pulses. At this time I would check the femoral, but because I have distal pulses, I can assume that there's a good flow. All right, at this moment I'm gonna move on with your abdomen area, okay? I'm gonna inspect, auscultate, palpate, and percuss. Okay, is that okay with you?
That's okay with me.
Okay, I'm gonna inspect first. I'm gonna check the skin looks intact, she feels warm, there's no bulging. Checking for hernias, I don't see anything at this moment. Everything looks uniform, there's no lesions. I'm going to start listening by quadrant. So everything is good, as I can hear vowel sounds in all the quadrants of your abdomen. I'm going to start palpating. It's going to start with a light palpation and then it's going to be a little deeper, okay? I'm feeling there's no bulges. The abdominal wall feels intact. No issues. It's going to be a little bit more deeper, okay? So with the bottom hand I feel, with the top hand I put pressure. I didn't feel any. Did it hurt you in any area?
No, nothing. No.
In this moment I'm going to check the liver, the border of the liver, okay? So you're going to feel a little bit of pressure. Take a deep breath. Go ahead. Let it go. Alright. I didn't feel any nodules at the border of the liver. I'm going to check your spleen. Go ahead, take a deep breath. Let it go. This is one way to check it. The other way to check it is positioning the patient to the side. I didn't feel anything. Did you feel any discomfort when I press? Now I'm gonna percuss. I'm looking for any dull sounds. Did it hurt? At this moment, I just go ahead and inspect the breast and the genitalia. Today, we're not gonna do that part, but in the breast, we check for lumps, any painful areas, and we also recommend the patient to do a self-assessment at least once a month. And then for the genitalia, we're looking for discharge, lesions, any inguinal hernias. We can palpate that area as well. We check that all the structures and everything is functioning appropriately. Do you have any issues that we have to be aware at this time?
No.
So that concludes the breast and female genitalia assessment. In addition with the genitalia, we're going to perform a rectum exam. We're going to check for tone. We're going to look for the wink. Check for any discharge, hemorrhoids, and males we do the digital rectal examination to check for any masses and any prostate enlargement. At this time, we're going to do some movements, okay? We're going to check your musculoskeletal. I'm going to start from the top, work my way down to your feet, okay? First, we're going to start with your shoulders. Can you rotate your shoulders for me? Any pain, any issues? Can you move to the side? Any pain at that moment? No. To the front. Go ahead. Put them down. Try to, there you go, push it down. Push it down for me. Any problems? I'm going to check cranial nerve number 12. Go ahead and move it against some pressure. All right, good. Can you squeeze my hands? Any issues? All right, we are. Any problems? Push away. Okay, try to bring it back. I'm going to do the same thing. Any, squeeze my hand. Any issues? No? Any pain? Go ahead. Against. Both our arms have the same strength, so there's symmetry, no issues. Range of motion is great. I'm going to do your legs at this moment, okay? Go ahead and flip over like that. All right, I'm going to do the assessment, okay? Go ahead and push it back. There you go. This one, your feet, there you go. The other way. I'm going to do the same thing. Go ahead, push it away against me. Push it down, up. Any pain, any issues at that moment? I'm going to check, okay, your knee. I'm going to check for the reflexes. All right. Do you feel it? No issues? No pain? Check here. All right. I'm going to do the same thing. Check the reflexes. I'm going to check your feet. Any issues? No. So I checked your range of motion is good. Do you have any pain? Any problems with your shoulders? We're going to do a series of exams, okay? It's going to involve the cranial nerves. We're going to check from 1 to 12. So the first one we're going to check the cranial nerve number 1 is for smell. I'm going to ask you to close your eyes. Cover one of your nostrils. Okay. Tell me what you smell.
Cinnamon.
Okay. At this moment, I'm going to ask to do the same thing in the other side to see if they have any smelling problems. Go ahead and you can open your eyes. At this moment, I'm going to do cranial nerve 2, 3, 4, and 6. 2, we already covered with the eyes assessment. We check for acuity. We check for constriction of the eyes, and just go ahead and do some series of movements. Could you please let me know if you have any issues while you do them, okay? Go ahead and follow my finger. Any problems? Any issues? Any pain?
No.
All right, let's go to the other side. Down. I didn't see any deficiencies. I'm checking for nystagmus. I didn't see any abnormal movement of the eyes. Okay, just follow my finger. I check for accommodation. So the next one is going to be, I'm going to combine the cranial nerve number 5 and 6. I'm going to check the trigeminal. You're going to close your eyes. I'm going to touch you in different parts of your face. You let me know where and if you feel it. And then we're going to do a series of movements with your eyes and your mouth to check your facial nerve.
My left side of the forehead above the eyebrow.
Okay.
My left cheekbone.
Okay.
My left chin. My right chin. My right forehead. My right cheek.
Okay, that's correct. Keep your eyes closed, okay? Try to open them. All right. Open your eyes. Big, 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 big. Okay. Smile for me. Go ahead. Keep your mouth closed. I'm going to try to open it. All right. Good job. So now I'm going to check your cranial nerve 9, 10, and 12, okay? Use different movements with your tongue. First of all, can you puff your cheeks? Okay, no problems. Let me just go ahead and check. Can you open your mouth for me? Do you have any mouth problems, any swallowing issues? Okay, say the uvula. I can see the raise and fall of the uvula. Can you please stick your tongue out, move side to side, no issues, no deficiencies. I'm gonna check your neck cranial nerve number 11, okay? Go ahead, shrug your shoulders, no issues at all. Now we're gonna do the acoustic part of it. We did the examination already. I'm just gonna ahead and ask you to stand for me, please. All right, this is called the Romberg test. Could you please close your eyes? Put your feet together, your hands to the side. I'm gonna be watching you for at least a minute to making sure that there's no sway, no issues at all. Go ahead and have a seat for me, please. At this moment, I'm gonna check for an additional sensory deficiencies. So this is gonna be, I'm gonna be touching you in different parts of your extremities, okay? Let me know if you feel a sharp or a dull object. Okay, open your eyes. This one is gonna be sharp. This is gonna be dull, okay? Any questions?
No questions.
Okay, I'm gonna start.
Sharp.
Okay, where?
On my right hand.
Okay.
Sharp on my right hand.
Okay.
Dull on my right feet.
Okay. In your right or your left?
On the right one, sorry.
Okay.
Sharp on my left feet.
Okay. Now I'm gonna ask you to stand for me, please. This is also to check your posture. Make sure that there's no posture issues. You look good, symmetrical, no problems at all with your extremities. Both of them look at the same length. I'm gonna ask you to give me a couple of steps. There you go. Go ahead and walk towards me. Right. No gait problems, no balance problems. At this time, we conclude our assessment.